Oral cavity cancers are lesions that form in one of the subsites of the oral cavity, usually due to some pre-existing risk factors such as smoking or drinking. These lesions can tend to grow and metastasize and can be fatal if left untreated. Symptoms of oral cavity cancer include pain, bleeding, or ulceration, which has not been getting better over time. If you have one of these symptoms and do not see any improvement over 2 to 3 weeks, I would recommend seeing one of your oral cavity specialists. Canker sores tend to be superficial ulcerations in the oral mucosa. The base of these tend to look tan, and they have no significant palpable depth to them. Oral cavity cancer lesions tend to be ulcerations in the oral cavity which continue to deepen over time. These have a palpable depth to them, and the classic story we hear in the office is a patient who had an oral cavity laceration which did not improve over 2 to 3 weeks and continues to be painful and worsening. If this is the case, then I would recommend seeing your oral cavity cancer specialist. This may be a dentist who is recommending an oral maxillofacial surgeon, but you may want to start with your general ENT. Oral cavity cancers tend to involve one of the subsites of the oral cavity. These include the oral tongue, the buccal mucosa, the floor of mouth, or the upper and lower teeth. The oropharynx subsites include the tonsils and the base of tongue. Oropharynx tumors are treated dramatically differently from oral cavity cancers. This is due to the HPV virus and the prognosis it portends on oropharynx tumors. HPV positive oropharynx tumors are treated dramatically differently and typically de-escalated due to the better prognosis. The treatment protocols usually involve TransOral Robotic Surgery and possibly some mix of chemo or radiation. Oral cavity cancers are treated in this institution using TransOral surgery. We tend to shy away from any incisions on the face. Oral cavity cancers can be resected completely through the mouth, and the decision for postoperative radiation or chemoradiation is made after removing the cancer.